was, hi everybody, and welcome to the June edition of our Real Mushrooms Facebook Live for pets. My name is Joni Kamlet, and I'm the director of the pet and practitioner departments for Real Mushrooms. And I have my trusty colleague, Dr. Rob Silver here. Hey, Rob.
I'm Doc Rob Silver, Chief Veterinary Officer of Real Mushrooms, and tonight we've got a special guest.
Yes, I'm so excited. We have Dr. Laurie McCauley here, and I don't know if you can see, like, she's got so many initials after her name. Dr. Laurie, I can't tell you how absolutely thrilled I am to have you on. Doc Rob and I both are thrilled to have you on. It's kind of a bucket list for me. I just want to, fill some people in on Dr. Laurie and I's history. We go back 20 years. I was trying to remember, was it 2005 or 2006 that I was, I went to school. I developed an interest in canine rehabilitation. And the veterinary practice I was working at sent me to the Canine Rehabilitation Institute in Wellington, Florida. And you were one of my teachers.
Yeah.
And I remember, I remember being so overwhelmed. I was like, so much to learn and everything. And, there was a group of veterinarians and there were a few registered veterinary technicians, which I was. And so I was feeling so intimidated. And then you came on, your course. The first thing you did was you taught us about our energy balls. I remember you coming on and sharing how to feel your energy ball. And I was like, oh my gosh, I found my people. Like this, like rehab and energy. This is so cool. And this human is so amazing. And I ended up, becoming certified in canine rehabilitation. And I was lucky enough to do my externship. So after you go through the course, which was a couple months of going and, flying to Florida for the weekend, it was not a small course. I got to do my externship at your practice, Tops, right outside of Chicago. And for those that don't know, Dr. Laurie, I say you're the GOAT, the greatest of all time as far as rehab goes. I mean, to study with you, Dr. Laurie developed the very first underwater treadmill. You developed the prototype for the underwater treadmill, which is being used in rehab centers all over the world now. That was your idea. Yeah. And I'll say, spending a week with you, I got to spend Monday through Friday with you and basically shadow you. And I learned more in that 5 days that I didn't learn in the course, your intuition, your knowledge, you would look at a case and just come up with an idea about how to get that paralyzed dog to start moving or how to stimulate them, etc. It just blew my mind. So, and then I got to, you had a police dog training academy connected to Tops, and I got to shadow how, I got to do a drive along to see how police dogs, potential injuries, they'd have scenarios, with a bad guy where the dogs would perform, what they were supposed to do so that we could see what type of injuries they might sustain. So anyway, I just want to thank you for that. It really, I was so inspired from the experience, and the opportunity to thank you publicly live means a lot to me.
Well, Tony, I don't know if you remember, but one of the words before you left that I said to you was, girlfriend, you have amazing energy. You are so talented. And your intuition is taking you in the right places. And I have watched you grow amazingly in the last 20 years. And I am so very proud of you.
Thank you. It's great that we stayed connected. And, I've been so lucky to have you as a mentor. And of course, Doc Rob as a mentor and so many other mentors. And now I want to know, so 20 years later, you're doing, you're still doing working with animals with musculoskeletal issues. You've got your Optimum Health Vitality. Like what excites you? What keeps you excited? What are you working on these days? And what do you want to kind of share with us?
So if you remember, Joni, the reason I started the whole rehab thing was because I was in general practice for 6 years and I got bored.
Yeah.
And I can honestly say since 1998, so almost 30 years, I have never had a day when I was doing rehab that I was bored, ever. Right? It is exciting. It's fun. It is amazing. So I'm still teaching, right? I'm lecturing all over the country. I've lectured internationally. I do writing. I'm doing more podcasts. I love teaching. It's what fills my heart. My mission in life is to empower people to help dogs, right? Yes. And I always laugh that I say I'm board certified in sports medicine and rehab for dogs. And it just fills my heart. So I practice 2 days a week. So I will never stop, right? I tell people I will never stop practicing. Otherwise I'd be giving up my favorite hobby. Yeah. And I love teaching. So Optimum Pet Vitality is my way to, as we get older, right? It's my way to help as many people as possible take the decades of knowledge that I have and then take that and grow it and be able to teach others and help the dogs.
Yeah. Sounds, it's amazing. We're so lucky to have you. And I know you're going to be teaching at the Feed Real Institute.
Yes.
In October, you're teaching a course on fascia. And always, so do you want to talk a little bit about that? And then we're going to move into Q. By the way, everybody, after we get over this love fest, we're going to bring Rob in and also move into Q&A. But
yeah. So I took some osteopathy courses and fell in love with it and learned about using a tuning fork. And I have taken that knowledge. And just like the same way I said, how many years ago, physical therapy, we can do that for dogs. We can do this and this and this and this and this. I've been taking the tuning fork and finding all kinds of uses for it, like amazing uses for it. Wow. So at the Feed Real conference, we're going to have like an hour and a half where people not only learn about it, but I'm bringing enough tuning forks so people can play with them and feel them. And then we have a whole course on it at Optimum Pet Vitality. So we have a fascia course, which is general. And then we have a tuning fork course that is just on the tuning fork because people found out about it and they're like, I want more. So it is just amazing. And it's so cool because it's giving me the chance, like I said, to never be bored, to continue to learn, and then to share that knowledge to help the pets.
Awesome. It sounds amazing. And I hope I'm not, like I said, we are going to move on, but I'm curious, like when you say fascia, like what is fascia and why is it important in musculoskeletal health?
Great question. So if you think about like if you were to make a turkey, right? And sorry to all the vegans that you may not understand this, but if you get a turkey and you want to take your herbs and you put it between the skin and the body wall, you're breaking up what we call soft fascia, right? It's soft, it breaks up easily, but it's holding everything together. It's holding the skin to the muscle. It's around every muscle fiber, around every blood vessel, around every nerve, around all the lymph vessels and the lymph nodes. And then you have your dense fascia, which is like if you go to cut into a steak and you see that silvery lining, that holds it outside of the muscles together. That kind of fascia holds your joints together. It holds your muscles together. And when it has an issue, when it has problems, you get fat infiltrated. So getting in there, messing things up, it gets all what I call sticky icky. And you can think about like when you're doing massage or you're taking tissue that's like all knotted up and releasing it. Right. So one of my favorite things is when I have a dog in my lap and they love me, right? I have the best job in the world. I get to sit on the floor and play with dogs and make them feel better. So they want to see me. Right. We call it melting because you take away their pain, you take away their restrictions, and they go from like, what's going on to, and they just like, oh, how do I lay over? Oh, just fix me here.
I love it.
Just amazing.
And we don't think about, like, I love that you're bringing fascia into the conversation. And now I'm going to bring Rob into the conversation because Rob, you have a bit of a rehab background too. Like, I know that you,
well, yeah, nothing like Yeah, I have a long history in practice. It's been 40 years that I was in practice, and I'm practicing in Boulder, Colorado, which is home to a lot of athletes who just love running with their dogs, and their dogs love running with them. But they would come to me with their dog limping, and I would, say that probably the first thing we need to do is a little bit of rest, not cage rest, but quit the running. And they go, oh, but he loves running with me, because they didn't really understand. Just because the dog loves running with them doesn't mean that it's not it will endure the pain, because it's so much better to be with the parent than to deal with the pain. So I did some of the early work with musculoskeletal problems, not as much rehab as I was doing massage and acupuncture and herbal therapies, as well as dietary therapies. And that was really something that I really never dug down into, was rehab. I got started learning some, and then I got distracted with CBD, and I guess CBD would probably be good for musculoskeletal as well as mushrooms. That's one reason we have our new mobility chews, because we're trying to address a very, very important segment of pet problems, the mobility issues.
Yeah. And actually, that's a great segue into our. So every month we actually offer a discount to those people that listen, and it's mobility 25 for 25% off site wide until the end of this month. And this is great because we normally do this like the last Thursday of the month, but because of scheduling issues, it's it's earlier in the month, so you've got a lot of time to take advantage of this 25% off. I recommend people take a screenshot of that or write it down. Mobility 25 for like site-wide, all of our products 25% off. And so let's move into some questions and see if we've got some Rob, your disclaimer also, and I guess that goes for Rob and Dr. Laurie.
Yes.
So although as veterinarians, Dr. Laurie and I just, we're impassioned about helping pets and about helping your pet, because we don't have an actual in-person doctor-patient relationship. We'll do our best, but we're limited by lack of information that you would have in person, and also just practice ethics. It's really not ethical for us to give you medical advice if we don't have that doctor-patient relationship. But we'll do our very best to answer your questions and help you regardless of the disclaimer.
Awesome. Thank you. So what is our first question? Okay, so the first question. Hi, for an arthritic dog with luxating patella, would you treat with prolotherapy or platelet-rich, also called PRP? Could you please speak to each of these treatments, pros and risks? Thank you very much. Laurie, do you want to take that one?
So my first question would be, with the luxating patella, is it a grade 1, 2, 3, or 4? So it totally depends on how affected it is. Excuse me. Excuse me.
Plus, whether there's underlying arthritis that has already developed there.
Right. So, for instance, if it's a grade 4, that means that patella is out of. So if this is the joint and the patella usually sits here and it's out and it won't go back in, prolotherapy, PRP, nothing's going to help it. It's not going to go back in, right? It's a surgical, and sometimes it's actually the bone is attached and even surgery isn't going to help it. So then you're treating the arthritis and you do the best you can with what you have, right? And that can be, could PRP help that? Yes, it could. It's not getting rid of the luxating patella, but it's helping the overlying arthritis. Your mobility chews, right? That's helping the arthritis and the pain by decreasing the inflammation and increasing the ability for the tissue to move appropriately. That's grade 4. Grade 3 is it's out and you can push it back in, but it wants to come right back out. That's usually a surgical thing. Now let's go the other way. Grade 1 is in and I can push it out, but it wants to go back in, right? For that, honestly, exercise is the best thing you can do. You strengthen the muscles. So if it's a luxating patella and it's going to the inside, you strengthen the muscles on the outside to help it come in. And if it's going to the outside, you strengthen the muscles to the inside to help it stay back in. And grade 2, prolotherapy can help with that. PRP can help with the arthritis part of it. You definitely want to use supplements whether it be oral. If oral's not enough, we can add injectable like an Adequan or something like that. So there's lots of different things. NSAIDs, so nonsteroidal anti-inflammatories, you can use. I personally like Boswellia better if it's enough, right? Because that's a LOX5 inhibitor. So we think of people saying like, is it COX-1, COX-2 inhibitor, which is what most of your like Rimadyl, Previcox, and those kinds of things are. You can always add those later. But to me, I want to do what's going to cause the least amount of secondary side effects and have the biggest effect, and then add more if I need to.
Yeah.
Your turn, Rob.
I love that.
Well, acupuncture certainly could be very helpful, and not just with needles. We can also do injection of homeopathics around that joint that could be very helpful, or we could put some electro into those needles, which also can help take that pain away. Soft laser, those are my tools. Lately, I've become enamored, of pulsed magnetic force. One product I've used myself has been the Beamer for my own pain, and it's worked quite well. I'm sorry, the CC Loop for my own pain, and been using that on my dog as well. So there are a lot of tools that are a lot less invasive than surgery, but I do want to speak up for the fact that there are times and places where the surgery is absolutely the most appropriate treatment, especially if you're catching that dog while it's young, before any kind of changes have occurred. It's the best time to do that, and it's a very forgiving surgery. It's not the post-surgical discomfort is relatively minimal. They're back to function relatively quickly. So that should also be part of our armamentarium of treatments.
Yeah, I'm glad you said that, Doc Rob, because I think rehabilitation is one of those areas where, often there's so many things I wouldn't do surgery for, but when you're dealing with orthopedic, it's structural, and with a young animal, if you're going to change the quality of life for that pet, let's go ahead and do it. But also, with these types of surgeries, age and size makes a difference. With a smaller animal, you might be able to avoid like a surgery, like maybe like the cruciate, for instance, or at least that's kind of what I saw, in rehab practice. I had a question for you, actually, Dr. Laurie, related to this. Now we don't want to stay on this question too long, but there's so much juice in here. Prolotherapy. I think it'd be a good idea to explain what these two things are for people that are curious. But back when I was doing rehab, prolotherapy we used for cruciate issues, as part of like more of a conservative management. Are you Prolo, or like, have you seen?
So anything, it's case specific, right? Yeah. So there's nothing in medicine that's a magic bullet that's going to fix everything.
Yeah.
But there are cases that prolotherapy can be very beneficial on, and luxating patellas is one of them, because you're injecting into the fascia, right, around that joint. So it's creating tissue that's going to help pull that and hold that patella in place. But again, that's a grade 1, maybe grade 2. Once you get into grade 3 where it's stuck out, that would not be my choice. So good point. Let's go through prolotherapy. Is where you have, at least when I did it, we would have like treadmill and a lidocaine, I think it was Marcaine, some B12 and some other things in there that we injected. And it was like 100 little dots into that fascia that caused it to contract and hold that patella in place. As compared to PRP, which is where they take a blood sample and they spin it down, and the plasma has all kinds of amazing chemicals in it. So if you inject the red blood cells into a joint, it's going to cause inflammation. But by taking the plasma, it has all of the growth factors and the anti-inflammatory factors and all of that, and it helps things heal.
Yeah, I've heard wonderful things. PRP was kind of after I had already left rehab, so I was curious to hear from you about what exactly that was. And yeah, with Prolo, back when the vet I was doing it with, it was injecting dextrose into the joint capsule.
That's
And I remember,
dextrose is one of the things that's in there. Yeah.
Yeah. And I remember the first time the vet that I worked with did it, like she cried because it seems so counterintuitive to be injecting something like that into, but you're basically trying to create a scar. Basically.
Yeah. Because what do scars do? They contract.
Yeah.
Yeah.
Very
It's
cool.
pro-inflammatory. I had Prolotherapy done on my wrist 30 years ago. I had a single treatment, and it made me nauseous. It was a bit uncomfortable, I will say, but 30 years later, my wrist is still fine.
Wow. Amazing.
Yeah. Amazing.
Definitely something to consider. All righty, we're going to move on to the next question. I have a 9-year-old boxer rescue diagnosed with hypothyroidism and wondering how mushrooms could help. Oh, hey, Dee. That's Dee from Performative.
Yeah, I saw her in Orlando.
Yeah.
Yeah.
You want to take that one, Rob? What do you think? I'm thinking like cordyceps, maybe.
Well, yes. Well, if you wanted to use a mushroom to address the issues around hypothyroidism, I would suggest using cordyceps. However, I would also suggest using thyroid hormone and getting this dog regulated with post-pill thyroids and making sure you're doing it right. Because the body needs this thyroid hormone, and without it, it's really tough to get it up to where it needs to be. So there's nothing wrong with appropriate hormone replacement therapy, especially when you do follow-up tests to make sure you're in the right range.
Thank you. Did you have anything you wanted to add to that, Dr. Laurie?
If I remember correctly, and again, I am a rehab vet, so it's a little bit outside my area of expertise. And Joni, this is your area of expertise. We used to use the standard process thyroid support.
Ditropin, PMG, or the canine thyroid support. I don't know that I'd use it in place of the
specific. Depending on where the is at with its thyroid, it might be that the use of supplements like the standard process or some others could, if you're in that marginal place where it really hasn't dysfunctioned but isn't really functioning, where those supplements could possibly give a boost where you wouldn't need to go down that rabbit hole of hormone replacement therapy and post-pill tests and so on and so forth.
Yeah. So I hope that helps, Dee. Next question from Beth Cohen. My 10-year-old has hip dysplasia since, 1-year-old, and IVDD surgery at 7. I'm wanting her to lose weight. She has difficulty walking far. She doesn't like to swim. Any suggestions on any other way to exercise her?
Oh, yeah. All right. So hip dysplasia. So hip dys means not, plasia means formed. So we're talking about a joint where it's not formed appropriately. And we usually have laxity. So what we need to do is strengthen the muscles specifically that hold that hip in place. And that's going to decrease that bouncing around that causes inflammation and then leads to arthritis and pain and all of that stuff. So exercises, my number 1 and 2 exercise for dogs with hip issues or could have hip issues, even from a baby, like, oh, I have a German Shepherd or a Rottweiler, sideways walking and backwards walking. Now, the caveat there is backwards walking is always amazing. And sideways walking is great as long as if you have your hand on their hips, they don't pop out. They're not luxating as they step in and step out. And then you could also, one of the important things is usually one side is more affected than the other. So you're going to go to walk them sideways, and one way they're like, oh, I can do this. And then the other way they're like, I don't know if I can, which means that's their weak side. So we start with that and we end with that. And we do short little bursts of it so that we're not taking them to the point of total exhaustion. We want fatigue, but not exhaustion. We want strengthening without things popping out because that's going to make things more lax. But yeah, sideways walking and backwards walking are the absolute best. And then you can always do things like leg lifts. So, remember like when we back in the 70s and the 80s, we would do, I'm going to take my leg and take it out, right? So you can take a dog and have them stand, and the muscles that help the hip in place are the ones on the outside and the ones on the inside. So it's this motion that we want to strengthen. So literally taking that, if this is their legs, one leg and putting it out and then shifting their weight so they bring it back in, or bringing it in and then shifting their weight so they bring it back out, which are much smaller motions. So if your dog's hip is popping out, that's where I would go first until it's not popping out, and then sideways.
Awesome. And for those people who've never done exercises, like to get a dog to go backwards, like it usually involves like treats, right? Like, you could get a dog to do a whole lot with, a treat. Like any other tips for how to get like engagement?
And on our website, so on OptimumPetVitality.com, we have a place on top that says Learn and Go, which there's like 100 free videos. And I know both sideways walking and backwards walking are in there. There's ones on YouTube that I've put out. Backwards walking, it can be anything from a treat at chest level and having them go back, right? Because you don't want to have a treat high or the dog's going to sit to get it, right? And what we want is big steps backwards.
Right.
And then sideways, you're literally, the easiest way to do it is to be on the dog's side, right? So that your feet are between, as long as the dog's big enough, between the front legs and the back legs. And then as you walk into your dog with that cookie in one hand, right? So you have the cookie here and you're walking into the dog. As soon as they step, you're like, yay, good job. Whee! Right? And they're like, oh, you want me to do this? Okay, I get fed. All I have to do is walk sideways. And the big thing to remember is you have to have the cookie in one hand. And then on the way back, you have to have the cookie in the other hand. Because the biggest mistake I've seen people make is they have the cookie in their right hand if they're right-handed, or left hand if they're left-handed, and then they turn around and keep the cookie in the same way, and they think they're going the other way, and you're not. So you have to switch hands.
Okay. Yeah, well, it's great that you have like the instructions on your website, because it's amazing what you can do. Like once the different exercises that are like, you don't need to, I mean, not saying you shouldn't go to a rehab center, but there's so many things you can do at home.
Well, we actually have Core and More. So if people are interested in learning the exercises, we have a course that goes through 24 exercises. It's a whole progression that you have. You start with very simple exercises and you build up. And it's everything you need to know to have a nice, strong, healthy dog, because it's the core, right? Hence the name Core and More, right? So it helps stabilize the knees, the hips, the shoulders, the wrists, the neck, the trunk, everything.
Yeah, fantastic. I'm going to check that out. Okay, let's move on to the next question. This is a good one. How can we recognize early signs of mobility issues in pets?
Can I take it? Can I?
Who wants to get? You want to field this one first?
Well, these are great for Laurie. Let's let Laurie.
Okay.
I'm loving her. So I'm fine.
Okay.
Imagine if somebody just went horseback riding or swimming or played basketball, right? And then they come home and they sit down and they relax, and then they go to get up. What do? They're like, oh, right? So if your dog is having mobility issues, you may see them what we call transition. So going from a stand to a sit to a down to a sit, or sit to a stand, slower. You may see them shift their weight. They go to sit down and one of the back legs comes underneath. They don't want to put their weight down. Right? It may be going to sit and they come down and then they drop. That's a sign of weakness, right? I can't control that motion.
Yeah.
And then you have the hesitation or inability or choosing not to, right? Mom went up the stairs. I want to go up the stairs. I really want to go up the stairs, but I know it's going to hurt, right? Or it's going to hurt, but I'm going to go really fast, so it's going to hurt only for a short amount of time.
Yeah.
Right?
Yeah.
I can't jump in the car anymore. I can't get on the bed anymore.
Changes in how they're sitting, even like suddenly they've always sat a certain way, and then maybe they'll only sit on one side, and if you try to move, they're resistant to rolling over even.
Or they lean back, right? And their back legs go out in front of them. Or they're pulling their weight forward, right? And their front feet, instead of being straight up and down, are back because they're trying to get weight off their back.
Yeah. Even being protected, like becoming maybe more protective of a certain area, or if you pet them and like there's like a little, like the little quiver on the back, like when you touch, there's like almost like a nervous system reaction. I that could be something, heat, feeling warmth in a particular area of the body.
Can we talk about that for a second?
Sure.
So whether you're left-handed or right-handed, your left hand is going to be more sensitive to temperature.
The receiving side.
Rather than touching the dog, just taking your hand over the dog and seeing if there's a change in temperature. So if it feels warm, that's usually inflammation, right? And if it feels colder, that's usually a lack of blood supply. So scar tissue or more fascia issues where it is literally like there's just less blood flow. And that's super important, right? Because if you feel that cold area on your dog, and it's not going to be super cold, but it's going to be just barely palpable, massaging it and rubbing it is going to increase that circulation. And the dog's going to be like, oh yeah, that feels really good. And then they're going to be able to move more.
Yeah. No, that sounds great. Rob, do you have anything you want to add? Even like what are some good proactive ways, to address mobility issues with food or supplements, things like bone broth, that type of thing? What mushrooms? Yeah.
Okay. Well, to answer the question in terms of what early signs would I look for in a pet that would indicate there's some sort of a musculoskeletal issue going on, I look to regular behaviors that they do. Simple things like getting on the couch, going up the stairs, getting in the car, the things that involve some use of their knee, their hip joint, their elbows, or their back, that if there is an issue with any of those areas, they're not going to function the way that they normally are functioning, especially if it's something where they're trying to be with you, which is a big motivation. And I think there are multiple ways to address this sort of musculoskeletal problem, and we start at the early signs of it, and we start with fairly simple approaches. I think Laurie mentioned Boswellia and its LOX5 inhibition. That's one reason why I have it in the mushroom chews. And if I could have mobility chews, and if I could have squeezed more ingredients in there, I probably would have put some highly bioavailable turmeric in there as well, because we find that Boswellia in combination with the turmeric really has a lot of potency. Been working a lot lately with PEA, palmitoyl ethanolamide, which originally I was looking at for allergies, but there's some good studies showing in combination with CBD that it also has a good reduction in inflammation, and pain. And so those are some things. Of course, the acupuncture is a good anti-inflammatory, and laser is a good anti-inflammatory. Fish oil long term at high doses is a good anti-inflammatory. There's anti-inflammatory diets that they can go on to. There's so many tools out there that we now know about, which can augment and improve their mobility with or without the medication. I mean, sometimes I think the medication is needed, because they are so severely painful, and supplements can't always get in there where they are so painful. So sometimes a short course with an NSAID, couple of weeks to knock it down, and then of course, the rehab and watching what their activity is, and, don't let them run those marathons with you for another couple of days, that sort of deal. So those would be my approaches to this question, this answer.
Yeah.
But
no, I think that. Yeah, no, I think that's great. Gosh, I'm having so much fun. This is great. All this conversation, but I would just add, I'm a huge fan of chiropractic, even proactively, don't wait until there's an issue, but like for myself and for my little dog Scruffy, gets regular chiropractic care. Also another sign that there could be an issue or pain would be licking an area. Dogs can't, if we have something like our wrist might hurt, we'd be going, like this, but dogs can't. So, licking an area could be, it might not just be a allergy hotspot. It might be actually a sign of some sort of inflammation, and they're trying to soothe that. Yeah, cool. Okay, well,
I'll just want to add in there that exercise done appropriately actually has been shown significantly to decrease pain, especially like arthritis pain. So So there's a lot of research behind that.
For humans and
Yeah, humans and pets. Yep.
Yeah. Before we move on to the next question, I want to announce, we say this a couple times, the 25% mobility 25 for anyone that's come on in the past couple minutes. You can get 25% off site-wide at www.realmushrooms.com until the end of June. That's off any product. So take a screenshot of that. I also want to let you know we're doing something really special because we have this special guest in Dr. Laurie. We're going to be doing a giveaway. And we're not doing it in the live tonight, but we're announcing it in the live tonight that we are giving away a bunch of goodies. We're giving away, and I encourage everybody to go. We're going to be announcing it on our Instagram page tomorrow. So on our Real Mushrooms Instagram, on Dr. Laurie's Optimum Pet Vitality page, and on the Real Mushrooms for Pets page, we are giving away Dr. Laurie's Fascinating Fascia course.
Mm-hmm.
We're giving away Doc Rob's book, There's a Mushroom for That. We're also giving away our mobility chews. So this is our new product, our mobility chews that we've been talking about. Our Daily Dog, which is back in stock. Yay, it's finally back in stock. And also a bottle of our Relax Chews, which is going to be great for 4th of July. So go to our Instagram tomorrow, and all the information will be there to enter to win this really cool giveaway. All righty, let's move on to the next question from Randy Rutledge. I have a 175-pound, not year-old, 9-year-old Mastiff with hocks that hyperextend. Left is worse than the right with bulging and instability. Is there anything rehab-wise that can be done? Wow.
Yeah, absolutely. There's multiple companies that will make braces that will allow them to, they can be hinged. So hinged braces, custom braces are the most expensive and the absolute best.
Worth it, yeah.
Absolutely worth it. Hero Brace, Orthoped.
Yep.
The multiple companies, and then some of the companies, I think even Therapaw has like just a neoprene that is not going to be as helpful, but if that's, everybody has their own time constraints and financial constraints, right? So that can help as well, where it has an elastic band that helps prevent it from hyperextending.
Yeah.
And then strengthen, right? It takes 3 to 4 weeks to strengthen a muscle, to have a change in physiologic effect. It takes 3 to 4 months to strengthen a tendon and ligament, and we can. So whether it be strengthening a cruciate ligament to prevent a cruciate injury, or in this case, strengthening the short and long, because there's multiple in the hock, the medial and lateral collateral ligaments, we can strengthen them so that it doesn't hyperextend. And at the same time, if that's going on, it may be related to something in the knee, the hip, the back, or they can all be related. So we have to figure out, so you need a rehab vet or someone who knows what they're doing to say, which is the primary problem? And then don't just fix the compensation, fix the primary problem.
Is that hyperextension traumatic, or is it like a weakness in the fascia and the ligaments, kind of more of a genetic type of thing, or nutritional? What do you know about that?
Are you asking me?
I think that's a question for you, Dr. Laurie. Yeah.
So it can be both, right? So it can be diet related. I've seen that where they are not on a good diet and their ligaments are just super lax. You can have some dogs, especially like Shih Tzus, that have hypermobility issues in their joints. I've had dogs where they can't extend their hips. So in order to compensate for that, they go up on their toes, which leads to then back problems. And then by going up on their toes, their hocks are straight. And then every time they go forward, they're collapsing into it, and they're chronically having that. I just had a case owned by a veterinarian of a dog that has major hock issues that I'm pretty sure is tick-borne related.
Wow. Yeah.
So or autoimmune related.
Yeah.
So one of my rules of thumb is anytime I have a dog with multiple joints that have a fusion or increased fluid in the joint, it's always my first rule out is tick-borne and autoimmune. Yeah. But I don't know that that's what's going on with this guy, because it sounds like it's just his hocks. But always, if you can, find out the original, the root problem,
Yeah.
not just repair the compensation.
Well, and you practice in a part of the country where there's a lot of ticks.
Yes.
Yes.
Absolutely.
Well, and I came from Chicago, right? Which is,
Yeah.
Wisconsin tick country.
Yeah. Yeah.
Yeah.
And now,
But here now, in the last 10 years, being down in North Carolina, it has skyrocketed.
really, yeah, it's really bad there. And I want to go back to I think it's an important point that you mentioned, Dr. Laurie, about that it could be nutrition. It could be nutritional, it could be vitamin and mineral deficiency. And I remember, I'm curious what you think of the hair mineral analysis, because I know that Ava Frick has done a lot of work around that, Dr. Ava Frick, and finding that dogs that have cruciate issues, have serious deficiencies in certain minerals. I believe it was manganese and zinc. Is that correct?
I can't say that because I don't know, but I'm smiling because about every 2 years I get my hair analyzed.
Okay.
It helped me with my supplementation and helped my health tremendously. So I am a huge believer in it.
Yeah. Yeah. It's muscle and weakness can definitely be a nutritional component to it. So it's important to make sure that the diet is balanced and all the bases are covered there. Yeah.
So Randy Rutledge answered some things here. She says, not traumatic, genetic, but worsened with tick-borne. So you're right on, Laurie. Raw fed and home cooked. Thank you. Tried neoprene with no luck, so headed toward custom bracelet.
Yeah.
Perfect.
Very helpful answer on your part.
Yeah.
Thank you.
I remember we worked a lot with bracing when I worked. I managed the Canine Rehabilitation Center in Walnut Creek for 6 years, and we did a lot of bracing and orthoped. I just love that. Seeing the difference between a custom fitted brace and one, you could spend a couple $100 online to try to save some money. But, taking the time to do the measurements and really work with a company that can create something unique to your pet, is really so valuable. Yeah.
Absolutely.
Cool. Awesome. Well, Randy, we wish you luck with your very large mastiff. Here's a great question. What are some everyday habits or routines that help support musculoskeletal health in pets?
Exercise.
Exercise.
Exercise
Yeah.
for humans and animals, right?
Yeah.
Longevity. And one thing to add there is it's not just walking your dog, right? So one of my favorite podcasts is Peter Attia, Stanford doctor, and he always brings on people that do a lot of research and things because I'm a nerd. I like research. And it's 3 different kinds of exercises that you have to have all of them to significantly increase longevity. So your endurance exercise, walk, run, swim. You have your strength training exercise. So in a human, it's like lifting weights. In dogs, it could be like sit to stand or beg, stand, bag, sideways walking, backwards walking, all of that. And then proprioception exercises, knowing where your feet are in space. So that could be like stepping over cavaletti poles. Or going for hikes, not on concrete, but in the, going over paths in the mountains where there's all kinds of roots and rocks and stuff like that.
Yeah, sand walking, the difference between walking in sand versus walking on concrete versus walking through a shallow creek, as long as it's, a safe creek to walk through, something like that. Walking through water, the therapy. Yeah. All
And diet, right? Getting enough protein.
Yeah.
Super important.
Yeah, absolutely.
And collagen.
Yes. Yes. Collagen.
Yes.
Britta, there was a question up there I saw kind of come through that I wanted to address about, somebody asked about how to help, tips for helping a dog accept a chair, like a dog wheelchair. I thought that would be a good.
I didn't see that.
Yeah, it came. We've gotten a lot of questions come through. I swear I saw that, somebody asking.
Well, and while you're saying that, it's super important to have the cart fitted appropriately.
Yeah.
So things like having the bar parallel to the ground. right? Making sure that the straps are all right. And most of the companies are really good. They're going to ask you, if you get a wheelchair, send them pictures, send them videos, and they will talk you through, oh, you need to shorten this strap or lengthen this strap or make it a little bit higher or lower. And most of the carts have some ability to adjust them so it can be just right for every dog.
Yeah. Another thing I wanted to add is a lot of rehab centers will have chairs, you know, and like people will donate chairs to the rehab center. So if you have a dog that needs a chair, it might not be a bad idea to reach out and ask if they have chairs for donation. And sometimes it takes trying a few different chairs. Like a dog one chair might not work for whatever reason, and then you try a different brand or a different type of chair, and that dog's off running, you know. So anyway,
this is good information. I'm actually considering a chair for Ollie.
For Ollie, yeah.
And I can't wrap my mind around euthanizing him just because his hind legs aren't working, you know.
Right.
So,
oh, I've got videos of dogs in chairs climbing up mountains, going over logs, going through the mud, and just being like, I'm going to do it. And their back legs are hanging in the chair, and they just love life.
Yeah. Yeah.
Well, we'll see. And I may reach out to you privately, Laurie, for some advice.
Yeah. And that's one of the reasons I wanted to mention that, because like working with dogs in chairs and seeing like, you know, working with clients and facing that and the resistance. And then when they finally did it, and, you know, the reality is, you know, dogs, they're unlike us. Dogs are not attached to their bodies as much, you know, like you lose a limb, they run on 3 limbs. Their back end doesn't work. You give them the opportunity to move, and, you know, they're off to the races. So it really can change their quality of life. You know, if they're down in the hind end and they most of them take to it so well. It's pretty amazing. Yeah.
So I see in here, Bindi Boxer, your comment where you say it just freezes. Throw a leash not on the dog, but on the chair. So imagine the chair has like a harness on it, and then you walk the chair, right? So the dog just starts walking with you. And it's not like, oh, come here. It's, we're going to go for a walk. And the leash is hooked up to the chair. So it's not pulling just one side. It's pulling from both sides like a harness. And then you walk, and it makes the wheels go. And then the dog literally has to walk with their front feet to keep up with the wheels that are moving around him. And then they go, oh, I can do this. And then as soon as they start walking, right, then there's lots of praise. Then there's the good job. Yay. Woohoo. Here's some treats, right? Special treats, not like something really special and tasty, right?
High reward. Yeah.
High reward. Yep. Yeah. And I also see the water therapy is not an option. It's June. So I don't know where you are, Bindi Boxer. Take your dog out to a lake, a pond, get them in the water, put them in a help them up or a walkabout or something that you can help support the back end, and walk them in the water. That can also give them high quality of life, because the buoyancy of the water lifts that weight off, and they can be walking through it, and the fish don't care if they pee or poop in the water.
Yeah. Yeah, we wish you the best with that, Bindi Boxer. I know you come on here often, and it's the first time hearing that you have a pup that has these challenges. So we wish you the best.
Yep.
Let's move on to the next question. Hi, I'm seeking ways to support my older beloved horse who had a ligament injury and has some age-related hock arthritis. Awesome. Do you work with horses, Dr. Laurie?
So I sometimes am a teaching assistant for IVDD, teaching the veterinarians how to do acupuncture. So when I do that, I have to work with the horses. And I have some clients that have horses, so I play working with the horses. But I can tell you, because I work with a lot of veterinarians, laser is amazing. Like Rob said, the CC loop or other PEMF devices is amazing. Massage, there's all kinds of things that can help modality-wise. Manual tissue work. I would not hesitate to say try a tuning fork with them and see if you can help them with that. And then supplements. I know it's a lot harder to get horses to take supplements than dogs, but there's certainly, whether you're mixing it with molasses, and again, this is outside of my realm of expertise, but there's things you can do to help them nutritionally as well.
Awesome. Rob, do you have anything to add? I know you do some.
I didn't hear you mention acupuncture.
Oh, acupuncture. Absolutely. Absolutely. Yes. Mm-hmm.
Yeah. I know, Rob, Doc Rob, I know you're working with horses, but it's more.
I'm doing more medical than muscular.
Not with like mobility issues. Yeah. Yeah. Very cool. Oh, this is a great question. Are there any differences in how mobility issues present in dogs versus cats?
Yeah. I always say that I am board certified in canine sports medicine and rehabilitation, because canine rehab has become huge, because if your dog can't get into the car and you have to help them, it's work. If your dog can't get up the stairs and you have to help them, it's work. If your dog can't get on the bed, you have to help them, it's work. If your cat can't jump on the counters anymore, most people don't realize it. And if they do, they don't want it to change. Yet cats get arthritis too, and they can be very painful. And they get it in the same joints, hips, knees, elbows, along their spine. So if you take your hand and you go down your cat's spine, and instead of them going, oh, that feels good, they drop, they probably have pain in their back. Yeah. And cats move different than dogs, right? So I always think of a cat like an owl. They can turn their head almost behind them. So you can do chiropractic, you can do acupuncture. Cats they live a lot longer, right? I've had cats 21, 24 years old, and we can help them tremendously. So they should be moving, they should be jumping, they should be meowing, going to the door, doing their cat things. You may see them having trouble getting into a high litter box, or a litter box that, they have to get up and then go into. If all of a sudden they pottying outside of the box, it may not be that they're being bad. It may be that it hurts.
Oh, yeah.
Cats, they're lighter than dogs, so the forces of gravity are not as great, but that's the price you pay if you let your cat get fat. So, portion control, very important, and sometimes can be almost curative. I, out of compassion and love and stupidity, allowed Ollie to get overweight, and he's on a very strict diet now, and 3 weeks later he suddenly seems to wake up. He's smiling more, he wants to go with me, hang out with me more. So and there was a question earlier that we didn't get to on weight loss. It is really important, and cats, cats oftentimes could also have front leg problems, because they like to get up really high and then they jump down on those wrists, and there's a lot of trauma there repeatedly over long periods of time. One of our cats, we have purebred Maine Coons, and he has hip dysplasia, as well as a VSD, a ventral septic defect. So that's the price of getting a great personality cat, but you've got too much inbreeding. So anyway, so that's my take on cats.
I want to add something. My experience is cats also tend to hide their discomfort more than dogs. It's just instinctive for them to keep that from you, that they're in any kind of pain. It's a survival instinct. Mm-hmm. And if I remember, and this was a long time ago, there was I think it was Purina or Hills did a clinical study about cats where they actually observed them around people and then observed them with a hidden camera. And when nobody's around, they move differently. This was, I think they were doing this study for figuring out some sort of mobility support for cats, but it was fascinating. They're like, when we're not around, they could be like little old ladies and men, and but they're keeping it from us. So, okay. Before we move to the next question, I want to give a shout out to Kenzie Miller, who is on. I see you. I saw your name, and now I see the Healthy Pet Nutrition. Doc Rob, this is a wonderful in a holistic pet store in the Pacific Northwest. And Doc Rob's going to be up there doing a book tour, and he's doing a book signing at the Healthy Pet. Kenzie, maybe you can put in the chat what that date is. And Rob's going to be reading from his book, signing books, and we're going to have a mushroom tea bar there. So you can come and try some real mushrooms tea.
So to answer your question, Kenzie,
let me read the question just for those. What is more effective for hip dysplasia, CBD or CBG?
Well, I'm not sure it's really the right question to ask, but hip dysplasia can be so severe that something like CBD, even at higher dosages, may not be sufficient to deal with it. Now, CBD, CBG, they're both cannabinoids from the cannabis plant. From studies that have been done benchtop as far as the relative potency of each in terms of their COX-2 inhibition. COX-2 is the enzyme that we use NSAIDs to inhibit, which reduces inflammation and reduces pain. But in that context, CBG was 20 to 50 times stronger than CBD in terms of that COX-2 inhibition. So in terms of using one or the other of those for hip dysplasia, I would go with the CBG. But that's one reason why in my Doc Silver Naturals cannabis tinctures, I have both CBD and CBG because I think they both have importance and in a wider range of applications. And so I don't think that I would want to do either or, but both.
Awesome. Anything to add there, Dr. Laurie?
Nope.
Okay. Yeah.
Rob's the master of that.
He's the expert. And by the way, this is a great opportunity to shout out that Doc Rob has his own platform as well. Doc Rob, the Well Pet Dispensary, where you can get the CBD products that Doc Rob's mentioning. Yep. And he also does his own Q&A, which will be, you're going to be continuing talking about lumps and bumps.
We are, yes. And that's going to be next Thursday. We're trying to time it so it's a week after each of these. And and it's my wheelhouse, really, cancer, lumps and bumps. So I expect there to be a pretty lively crowd.
So if you want more Q&A with Doc Rob, head over to his Well Pet Dispensary site.
Thank you, Joni, for that.
Sure. Next question. What are common red flags that may indicate a deeper musculoskeletal issue?
Holding your leg up. If a dog's not putting weight on a leg, it's definitely an expression of pain. That's probably the simplest way to look at that.
Yeah. I would say if a dog is holding their leg up, either there's something going on with the foot. So, right, it could be a broken nail, it could be a slice in the pad. It can either be foot related or, like you said, Dr. Rob, it can be something severe, like I've torn my cruciate, I have bone cancer, something super big. So that is a huge one. And I guess my question there is when you say deeper musculoskeletal issue, I guess my question back would be, what do you mean by deeper? Is it just more painful?
More severe, maybe.
Yeah,
more severe.
Yeah. If it was deeper, it would be something would be observable. There'd be a limp. There'd be a holding the leg up. There'd be a inability to move. And
that's a really good one too, right? Because I love that you bring that up, Joni. Is if your dog has trouble getting up and like they were getting up yesterday and they're not getting up today, that's a medical emergency.
Yeah.
Right? Because they can either have a fibrocartilaginous embolism, FCE, which is like a stroke to the spine, or they can blow a disc and be paralyzed. And it's one of those things that if you can and choose to do surgery to fix it, that is your gold standard. Acupuncture is amazing. Acupuncture helps 75 to 80% of cases, whereas surgery is like 85 to 90% of cases. But it's like a 3-day window. And the sooner you do it, if you're going to do it, the better chance you have of getting full recovery. So I'm so glad you brought that up, because that is something people need to know. It's not like, oh, let's just wait a week and see if he's going to get up on his own.
Yeah. And it could also be like something like hemangiosarcoma too.
Yeah.
They could, it could,
Wow.
like any situation where your dog's not moving is something that could be a medical emergency for sure.
Actually, with that, can we just say, please, if your dog doesn't get up, lift their lip and look at the color of their gums.
Yeah.
Right. As Joni just said, with hemangiosarcoma, they can even be a hematoma or a hemangioma. So you're not even cancerous in the liver or the spleen and burst, and they're bleeding internally. Yeah. And that too can be a medical emergency, even if it's not a cancerous growth, but they can bleed out.
Yeah.
If you lift up the lip and it's bubblegum pink, you don't have to worry about it as much.
And you want to press, do you want to actually check the?
Yeah. So we can talk to them about that too. If it's white, you get your butt in the car and you take the dog to the emergency clinic. If it's like, oh, I don't know, like Joni was just saying, you take your finger and you put pressure on it and you take your finger away, and it should blanch. It should turn white. And then within 2 seconds should be pink again. If you put your finger on it and it's 3 seconds, 4 seconds, that means there's not enough blood or blood pressure, and something is seriously wrong.
Yeah.
Oh, yes. D, perfect. Yunan Bayao. I love
yes. Yunan Bayao. Yes, definitely.
Yep. Stop bleeding.
Great for the emergency kit. Yeah.
Well, and Yunan Bayao, it doesn't just stop bleeding. It's actually been shown to reduce the growth of the hemangiosarcoma cancer.
Yeah. We've used it a lot in cancer.
Yeah. Pretty amazing. Can you believe we're out of time?
No.
It's like already like on after the hour. It goes by so fast. And gosh, this was fun. Dr. Laurie, it's been such a pleasure, and getting to see like two of my heroes, like getting to engage with both of you has been great. Loved having all the questions. Just to repeat, Dr. Laurie's, and I know Britta dropped your link for your website, Optimum Pet Vitality. You can go, and I encourage everybody to go there and look over the site, look at Dr. Laurie's exercise tips, take her courses, and come to the Feed Real Summit. And we're going to be there. Doc Rob and I are going to be there. Our colleague Lee Carroll's going to be speaking there on mushrooms. And Dr. Laurie, you're going to be giving a course using those the tuning forks.
Yep.
Yes. So that's going to be awesome. That's in October. Mobility 25 for 25% off site-wide at Real Mushrooms until the end of this month. And come on to our Instagram pages tomorrow to see about entering to win a big fat giveaway of Dr. Laurie's Fascinating Fascia, Dr. Rob's, there's a mushroom for that book, our mobility chews, our relaxed chews, and our daily Dawg. So it's been fun.
Awesome. Thank you guys for having me. I really appreciate it.
Oh, thank you, Laurie, for being had.
It's been great. All righty, everybody. We'll see you next month.
Stay healthy.